Good morning. I'm Dave Anderson and serve as chair for the Kansas Behavioral Sciences Regulatory Board. Today is Monday, May 11th, 2026, and I ask the members of the board to respond to a roll call to signify their presence at this open meeting that is being conducted in hybrid form, with some individuals remote by conference call or other electronic medium, and some individuals present at the board's office. Denise Seisman.
Present.
Jill Flessing.
Present.
Linda Heitzman Powell.
Present.
Donna Honer Quill is not here today. Mary Jones.
Present.
Jim Kilmartin.
Present.
Richard Nobles.
Present.
Andrea Perdomo Morales.
Present.
Cynthia Schindel.
Present.
Laura Shaughnessy.
Present.
David Stevens is also absent. I note the following staff members are also present. David Fye. Here. Leslie Allen.
Here.
Cindy DeArcle. Thought I saw her earlier.
Cindy is just entering through the waiting rooms.
Okay. Tim Resner, serving as legal counsel for the board, is also present. Here. Next, David Fye will read a message concerning this meeting being held remotely.
Thank you, Dave. This is David Fye, Executive Director for the Kansas Behavioral Sciences Regulatory Board. Public comment allows the public to address the board about any concerns, but the Kansas Open Meetings Act, or KOMA, does not require the board to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. No time has been reserved for public comment, as no individuals request time for public comment. Because we are conducting this public meeting in hybrid form, I state for the record the following information. Access to this meeting is being conducted in person and by means of interactive communication electronically, allowing members of the public without cost to attend the meeting either in person or through the use of the conference call or by viewing the board's YouTube channel. While the meeting is conducted in hybrid form, the requirements of KOMA are not suspended. Therefore, we will be conducting this meeting pursuant to the KOMA. On April 22nd, 2026, we sent notice of the board meeting to all individuals who had requested notice of such meetings. The notice was also posted on the board's website at ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other meeting material have been posted on the board's website and are available for review. You can also request a copy of the agenda specifically by sending an email to david@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel, allowing members of the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may send an email to bsrb@ks.gov. A recording of this meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the agenda. And the conference call line is active. We did check it before. There's no one currently on that line, but if I hear someone announce themselves, I will let you know.
Seem to be getting a little bit of feedback.
Cindy, I think we're getting some feedback, so could you mute unless you're speaking?
Are you talking to me?
Sorry, Cindy.
Yeah.
Thank you, Cindy.
Thank you, Dave. The meeting's now called to order and the board will begin its discussion of the first item on its agenda. First of all, just welcome all. It's nice to see so many of you here in person. First thing we need to do is approve our agenda. So I would entertain a motion.
Second.
Okay, thank you. We have a motion and a second. Is there any further discussion? Hearing none, all in favor of the motion, please say aye.
Aye.
Pose same sign. Motion carries. Thank you. We have no one for public comment. And we'd like to take a moment to welcome Dr. Bernetti Atwell. Dave will give us a little background information on her.
Absolutely. So welcome to the meeting, Dr. Bernetti Atwell. Dr. Bernetti Atwell is the CEO for the Association of State and Provincial Psychology Boards, ASPPB, and that is the national association that helps all the different states and Canadian provinces that regulate professionals in the area of psychology. Marianne Bernetti Atwell.
Marianne.
Is it Marianne? Okay. I'm
Marianne.
used to calling you Marianne, so thank you. Mary Ann has been a big help to me. I've been executive director now for the BSRB for about the last 5 years, and one of my first connections to the national level was Mary Ann. She does a great job of reaching out to different contacts with the different boards that regulate psychology, and she mentioned a few years back that it was a priority. She was going to be going out and trying to visit all the different jurisdictions. And so we invited her to come to see us all in person, and she's been very gracious to come and visit with us. And so I'll turn it over to you, and maybe you can share a little bit about the work that you do, maybe a little bit about that association. We bring back updates to our board here, but it would be nice to hear from you. And just to let you know, too, the microphone in front of you, it's just for decorational purposes. The real microphone for the meeting is with the owl. So feel free to talk into the owl. And but yeah, really happy to have you here and looking forward to you sharing with us today.
Wonderful. Well, I just have to say thank you. It's an absolute delight to be here. This is like the fun stuff that I get to do. So I'm very appreciative of that. And David, I just have to give a big thank you and a big shout out to you. How he represents you and your state is truly phenomenal. We have 66 jurisdictions that we serve at the association throughout the United States, its territories, 10 provinces in Canada, and the Northwest Territories. And I love all the 66 equally, of course. However, there's varying levels of engagement for a variety of reasons. And I'm always very respectful of that, but I have to say, David is very engaged. David is involved in serving on committees. He's involved in asking questions. He's involved in making us be better on behalf of his questions and the representation. So I just want to say publicly, thank you.
Well, thank you.
You're welcome. So, gosh, I'm trying to be small in what I say, but I think as a board, we have so many goodies for you that I hope you're accessing. The one thing is we put up a new website about a year and a half ago. And if you're not on Sci-Hub or access to Sci-Hub, please let David know so we can get you connected because you have a whole slew of access to resources and communications. And speaking of communications, we're really making communication a priority for the association. We have learned through listening to where we have had areas of improvement that we should consider, and communication is one of those. So we are really trying to put more and more communication out. Now, granted, that's a bittersweet thing because sometimes individuals will say you're not communicating enough, and then at other times it's like, please stop communicating. So I want to recognize that is that we're trying to balance that, but at the same time, just want to make sure that you stay informed on everything that's going on within the association. A couple areas just to highlight, if you don't mind me doing that, is we have really been trying to utilize surveys and town halls more over the last year, 2 years. And we really feel that that's an opportunity to bring information before our members and also an opportunity to listen to our members. So a number of those situations have been, we did a town hall in regards to APA's model licensure act when they put it out for draft proposal, because we want to make sure that jurisdictions were aware of that. We also have utilized surveys for what do you think about masters licensing or master's exam. We also put it out for what do you think about a model licensure act. So important, the information we received on all those levels, because it is truly guiding the association, what it does and what it doesn't do. I think the association has an opportunity to work not only with the jurisdictions, but a variety of liaisons in the psychology arena, whether it be training and education, whether it be practice or the regulatory world. So we're always hearing different things and we're wanting to be ahead of a variety of things, but we also recognize that our regulatory community may not be ready for some things also. So that's truly a balance. with that also. So a couple of other things, we are going to be eliciting information from all jurisdictional boards in regards to how are we doing. We set up a strategic plan back in the end of 23 that goes to 28. And that strategic plan was really developed by our jurisdictional feedback. So we really are needing to gauge how are we doing. I don't really want to assume we're doing well. And I don't want to assume that I know exactly the areas we need to do better. So that's being pushed out. You're gonna have about a 2-month window because we also wanted to give plenty of time because we assume no one person is going to be the person to give feedback on something like that. So that information will go before the board, and the board will be working on a new strategic plan starting next year. So this is on the cusp of trying to be fresh, trying to be soliciting of information. So that's when you get that and you see that, please take some time because it's really looking at every department within the association and the services or the assistance we provide in every one of them. You know, that EPPP gets talked about a lot, but we're much bigger than EPPP. And I think there's so many other areas that don't get the attention that they need or might not be thought of because just that EPPP, we're more than an EPPP. I also want to make sure that we also put out a legislative tracking tool, the policy note. And that was really at the feedback from the jurisdiction. So if you haven't used it, please take a look at using it. It's great just to kind of go around and just see what's happening in different parts of the nation. I receive a report each week from a policy note. I have an analyst that preps the summary. So I'm staying kind of on top of what's going on, not just in one jurisdiction, but what might be a trend or a theme. And, you know, we've been seeing things with AI. We've been seeing a lot of legislation around the compacts or with the school psychology area has been a lot of information. And we've also seen some increased tracking, increased work in the area of prescription privileges. Just Vermont just passed prescription privileges just about a month ago while we were at the mid-year meeting. It went in front of the governor and then the governor signed it a week after that. So another state that's doing that. So, and there was some language out there. Hawaii was looking at it. So it's interesting to see what's happening in that area also. I want to share that the association has supported jurisdictional financial assistance for jurisdictions to attend our mid-year and annual meeting. It's really been minuscule. It was $500. And if you didn't use it, you could roll it to the next year and it was $1,000. I do think it was minuscule. So the board has made a new decision starting this year. The board will fund a voting delegate from each jurisdiction to attend the annual meeting and will support the cost of airfare and hotel lodging. So we are going to be working with a travel company to assist with the airfare. So there'll be no money out of pocket. And we will then just add that voting delegate into the room block for that period of time. So again, as we were brainstorming this, having worked in state government for about 18 years, it was very clear to me that you can't reimburse. It doesn't go back to your line. It'll go back to general revenue in most situations. So we're trying to eliminate all that changing of money and making it a little easier. So there'll be more information coming out on that, but we're also hoping not only do we get one from a jurisdiction, but maybe that will offset those funds for maybe another individual to attend. So more news will be coming on that. References. So on our website, we have a variety of references. One that I really want to bring to your attention, if you haven't looked at it, it is the In Focus publication. We produce a new In Focus this every summer. The latest one that you'll see out there right now is 2024, because we're always a year behind. David has been very involved with this. It all is generated from a survey, and it populates information that's very global for every licensing entity, whether it be titles, whether it be requirements, whether it be the number of licensees, whether it be various costs. There's also a section on the EPPP and numbers, and discipline data is also in there. If you haven't looked at it, I would encourage you to look at it. I consider it kind of one-stop shopping. Because you can see so much information from all jurisdictions that complete that. I believe last year, 50 of the 66 completed the survey. So it's really good, especially if you're working with, I use it with students all the time. As I speak to them and they're thinking about getting licensed, it really is a nice summary of the requirements. And then those of us in the profession, it's a good tool for all of us too, because sometimes you're curious about a little information about somebody else, or you might be thinking about taking a job somewhere else, and it'll give you that kind of snapshot. We also just, in March, put out a member policy and procedure manual. So this is the first time we've had a member policy and procedure manual. Our PMP was really on the internal side and not the external. So as the jurisdictions voted on the bylaws in October of last year and approved that new revision, and David, I want to thank you. I believe you had a touch in all that work. So again, thank you. What that member PMP has done is it has operationalized the bylaws. So it should be, it's very transparent. It's given process and procedure to what the jurisdictions voted out in that meeting. So as we were developing it, I thought, well, this won't be that. I believe it's about 113 pages, and it was like, what's happening? So if you can't sleep, it might be something you might want to read. It'll help you get some shut eye. Also, I just want to mention that there is on the website quite a bit of information about the exam. As you know, the exam is going through a bit of a facelift, and there is a timeline that we continue to update because there's just a little more new information. So what I've learned is there's a lot of information, and I go back to, I need to assume nobody's remembering it, or maybe nobody has seen it. So we are kind of double communicating and layering our communication. So if we bring in a new element, we're pairing it with the last element. So you'll see that kind of treeing out of information, and that's really the purpose and the logic behind that. And so you all can have all that information in one area. A couple of those unique items to mention is right now we're going through item writing. We've gone through bank maintenance, looking at the about 3,000 questions that are already developed and looking at how those can move into the new exam. We will be setting up a new sample exam for we're just using integrated now. When it's live, it's the EPPP. It doesn't have a new trendy name. EPPP will be the EPPP by name. But we're building a new sample exam that will focus on that new blueprint. And that should be available this fall. We are looking at beta testing March and April of 2027. And the reason that is needed is to confirm the current pass score, the cut score. It's not about developing a new one, it's about confirming. So that will take place over those 2 months. And then from there, it'll take about another 2 months to review statistically that information. And we're hoping that those individuals who have been interested to take that beta, that jurisdictions will consider a pass on that, they pass on the EPPP. If they fail the beta, we hope that that doesn't go against them and they're able to take the regular EPPP. So the cost, I hate talking money, but I think, it's one of those things everybody's always interested in. The beta will be $100. If an individual fails the beta, we're gonna offer the EPPP at $100 also.
Mm.
Because it's just, they're doing a lot to be willing to take that beta, and we need them to take that beta. It's important. So that is what that will flow out like. The new exam will be stood up the fourth quarter of 2027. Individuals who take and fail the one or the two's not important, use the two in your state. Before the new exam goes live, they will be able to continue to access the EPPP1 through the end of March of 2028. Because we also wanted to give them the opportunity to be able to access that same blueprint, that same test, should they have bought and test prep materials, should they have studied for that blueprint. They're able to pivot to the new exam should they like, but we want to go ahead and give that grace for those that have failed. However, the day the new test goes live is the day that all new individuals who have never taken the exam will have to take the new exam. So I think those are a couple of important pieces with that. Also, David, you had brought up at the mid-year meeting, the language that was shared in regards to the cost of the exam. So the cost of the exam, as you know, is $600. The cost of the exam is going up to $650 in April 1 of 2028. Because at that time, everybody will be using it. We will not have those that will still be using the one. So it's a good hallmark period. The other item is that the board has indicated that starting in 2030, they will be looking at increases to the exam based on the CPI, Consumer Price Index. The language that was out there was it mirrored the motion, but what it didn't do is it really didn't take into consideration the spirit of the conversation that also took place. So when you look at the website now, there's an update that speaks to the board will consider increases to the exam starting 2030 every 2 years with the CPI being looked at and taken into consideration. It is not always going to happen. So we wanted to change that language. We appreciated your feedback, David. We've heard that from a couple of other jurisdictions. So the board wanted to be very sensitive. As you know, you make a motion and you need to go forth, but there's a lot of other conversation and subtleties around those motions. So we've cleaned that up. So just wanted to mention that. Looking at my notes here, see if there's, I think that's pretty much for the exam. I will say, and I will mention 2 things and then I'll be quiet. We are going to be conducting a town hall June 9th. And this town hall, we sent the invitation to the board administrators and registrars, with them being able to extend the invitation to their board members or their staff. But this is about the steps to the implementation and registration of the new exam. And what we're going to do is we're going to really speak to many of the pieces of information we've already shared, just to make sure people have a good understanding of what's happening. We're also going to be looking at creating a narrative that jurisdictions can use about the beta testing period, because we figure there's no need for you to have to craft that information should you be a jurisdiction that are going to allow your applicants to take that beta. So we're going to put out information on that. We're going to also talk about registration, and there'll probably be additional, or not probably, there will be additional town halls that will be rolling out between now and the first quarter of 2028. Just making sure everybody's coming along with the information that you all need and thinking about everything that needs to be in place with everything. So I'm excited about that. I will help our team host that. And we will look to the jurisdictions for some guidance as to what are topics for additional town halls for guidance on instructions with this. And then the last thing I will say is we are in the kind of middle of call for nominations. So we really rely a lot on our volunteers. And we have a lot of volunteers and we value them. And so the call for volunteers is open until the end of May. So if you're interested in volunteering with the association, there's a survey you can look at. We'll get that information to you if you don't have it. But also the call for nominations and awards are open till June 4th. So there are 2 positions for the board. The first year director at large, which is open every year. And there's usually a normal progression to the president-elect from those directors at large, but it is an elected position also. So I would encourage you all to think about that if you have it. I think we have a really great board. And those awards, really think about the work that you all are doing here. There are a number of awards, whether it be for staff, whether it be for regulators. You all should lift up from your own ranks and your own jurisdiction. I think that's very important. Sometimes we focus more on the challenges than we do on the celebrations, and the work that you all are doing is so important. I had sat on the Missouri board for about 7 years, so I know your work. I appreciate your work, and I value that. So I'm going to stop there. Thank you for giving me that amount of time.
Thank you. I mean,
And I appreciate all the comments that you shared. One note I will say is that a lot of the information that you discussed is available on the ASPPB website, which is asppp.net.
Yes.
For most of our board members, as a composite board, we have our advisory committees for each of the 7 different professions the board oversees. And so there are certain members that sit on some of those advisory committees. And so a lot of the communications for, let's say, ASPPB, those primarily go to the board members that, let's say, serve on the Licensed Psychology Advisory Committee or the Master's Level Psychology Advisory Committee. But if there's other board members that would like to be added to, let's say, any of the notifications from ASPPB or anything like that, please let me know. When I initially stepped into this role, I think I was receiving notifications from ASPPB, but also the Social Work Association, Professional Counseling, and they wanted the entire list of board members to send everything to everyone. And I said, well, let me check with our board members and see if that would be too much information, because I don't want people to not read the information. I want them to, but there is a point to where there's a balance there. And so, but if any of you board members are not receiving the notifications and you would like to be added, please let me know. I'm happy to add you to that list. But a lot of the things that Marianne talked about are on the website as well. Sure.
Yes, thank you, Dr. Bernetti-Atwell, for being here. We really appreciate that, the information you've shared. We'll move on our agenda to the review and approval of minutes from the board meeting on March 9th. So everybody had an opportunity to read those. Any requests for changes to the minutes? Seeing none, I would entertain a motion. Thank you. Thank you. Okay, so we have a motion and a second to approve the minutes. Any further discussion? Hearing none, all in favor of the motion, please say aye.
Aye.
Opposed, same sign. Motion carries. Thank you. That takes us to the executive director's report. Dave?
All right, thank you, Dave. I will try to go quickly. There've been a number of different meetings and items here, but I know we have a full schedule today. So Just highlighting a little bit of outreach efforts. Leslie and I were able to talk to several different groups of students. This is always a priority in the spring and in the fall, when we had the opportunity to talk to students about how to apply for licensure. We tried to demystify that process and make them feel more confident and more at ease, and just kind of help them understand the steps and who they'll be talking to and working with. We also talked to them a little bit about their preparation to become a professional. We tell them a little about the role the BSRB has, and how we are here to provide resources to them, but also our role with public protection. And we talk about their role as a professional and making sure that they are diligent about stepping into this role and being aware of the professional conduct, regulations, and those standards. And so we've been continuing to reach out to more and more schools, and we're continuing to add to the list. So please feel free to put us in contact with anyone if you think they would benefit from a presentation. We are also broadcasting our meetings on the YouTube channel. I have the numbers there as far as how many meetings and how many views. In terms of our budget, I wanted to provide a little bit more information in terms of our budget for the year as we're wrapping up this fiscal year 2026. Just to kind of go back a few years to put this all in perspective. As a state agency, we don't receive any money from the state general fund. We operate based on one fund. So we have the BSRB fee fund, and we receive revenue when individuals get licensed primarily. And then we operate based on a limit that the legislature sets in an appropriations bill each year. If we don't spend money in our approved budget, it doesn't go anywhere, it stays in the fund. So we ask for a certain limit based on projections, and then if we can find savings, we do our best to do that. So just to let you know, that balance in the fund, looking back a few years, back at the beginning of fiscal year 2024, which was July 1st, 2023, the balance was a little over $2 million, $2,027,000. At the beginning of fiscal year 2025, which was July 1st of 2024, it had gone down to about 1.9 million, or 1,886,000. Back in July 1st of 2025, which was the beginning of fiscal year 2026, it had gone down for 1,791,000. And just as a reminder, this decrease was by design by the board. The board wanted to lower the balance in the fee fund, but do it in a responsible way. And so the board lowered a lot of the renewal fees with a plan to continue to monitor this as it was going down. So the current balance at the end of April 2026 is about 1,619,000. The approved expenditures for the entire year are about 1,242,000. What we had actually spent as of the end of April was just a little over 1 million. So we still have sufficient space in the budget through the end of the fiscal year. Our revenue for the year is right around 800,000. It should be noted that these numbers do not include the statutory 10% that has to go to the state general fund. That's just something that's in law that we have to contribute up to a max of $100,000 per year. I would note that usually June tends to be one of our higher revenue months, and that's because a lot of people are graduating and applying for licensure. Some of them are getting licensed. And so I think we'll be in good shape. We continue to be in good shape, both in terms of the fee fund balance going down, but also in having sufficient funds to pay for our operating expenditures. In terms of some staffing changes, I did want you all to know, we did have a staff member who chose to go pursue some other opportunities. My assistant, Emma Allen, had been a really great member of our staff. She just had an opportunity that was too good to pass up, and we realized this is going to be the case from time to time. We put our employees in a good position with professional development opportunities and other things. We want them to do what's best for them and their long-term career. So if we can help people along that path, we do our best to do so, knowing that we will continue to really enjoy the staff members once, as long as they are here helping us as well. So Emma's last day was this past Friday. While we will miss her, we're going to make some plans in the meanwhile. And so we will have some temporary staffing coming in the immediate future to help us out with licensing and coverage. And then we'll be advertising in a new position to go ahead and fill that. I don't know the time frame yet. It'll kind of depend on how quickly we get individual applicants applying for that, but hopefully we'll get that wrapped up, hopefully in the next month in terms of a permanent employee. But in the meanwhile, we'll have temporary staffing. So we'll have individuals helping out in a few different areas, make sure we have coverage, but that's the plan for the immediate future. In terms of some other changes, advisory committees, 6 of the 7 advisory committees for the board will have openings. These terms run through the state fiscal year, so July 1st to June 30th. 6 of the 7 will have openings. So on Friday, we sent out messages to 5 of those professions, all the permanent licensees, letting them know that there were openings and if they were interested to send a letter of interest and a resume or CV to me. And I'll collect all those and provide those to the advisory committees so they can discuss new members and then decide how many individuals they wish to recommend for new appointment positions. Social workers are all going out today. And part of that is because of some of the limitations on Office 365. They cap how many emails can be sent on a daily basis. We have about 17,000 permanent licensees, so we did about half of the total on Friday, and then we're doing the other half today. So, but if you know of anyone, we did post a general message on the website for the BSRB. We're holding this open for 2 weeks, so any individuals who wish to submit materials, they can do so within the next 2 weeks, and we'll collect that and provide them to the advisory committee. In terms of some legislative updates, as far as the BSRB budget, every year, like I mentioned, we ask the legislature for a limit on how much we can spend. We don't ask them for any revenue, but we just say, here's what our projected expenditures are. We would ask that you put a limit and we won't spend above that limit. They did go ahead and recommend the same amount that we were approved for by last year's legislature. So no changes in fiscal year 26 and fiscal year 27. We had mentioned this earlier this year, but the 2025 legislature put in a pay plan adjustment, but only added the money for fiscal year 26, not for 27. So there was a technical adjustment this year. So with the exception of that, we asked for the exact same amount that had been approved. The legislature agreed with that. And in this session, the legislature did go ahead and put in a 1% increase in state employee salaries. So that was a little bit lower than what has been sort of the recent trend of about 2 to 2.5%. But there will be a 1% increase. And so we are happy with that there was some recognition by the legislature. We'd love to be able to pay the staff members more, but our hands are somewhat limited. And so that will be in the final numbers, but I don't have those totals currently. As far as legislation, there were a number of bills that were discussed, but several of those that could have affected the BSRB did not actually work their way through. One of those I will call attention to is House Bill 2506. That would have added an apprentice addiction counselor position. So basically, when that bill was introduced, there were a lot of discussions. We kept the board members informed. There were concerns with the initial draft of the bill. And ultimately, there was a big meeting of the advocates and interested parties, and it was decided to go ahead and continue to work on things in between this session and the next session, and hopefully come to resolution on a compromise position or something that could be helpful. So at the last board meeting, I talked to all of you about that. The board ultimately decided the best avenue for this would be the Addiction Counseling Advisory Committee. So there's a meeting of that advisory committee coming up in June. And I have talked with Travis Lowe, who's the representative for the advocates for the bill. And he did indicate that he believes they will be able to attend that advisory committee and talk to the members as far as what their interests were. And then hopefully we can learn a little bit more about if there's a way that we can be helpful in this process, with the ultimate goal of if there's any recommendations that could be forwarded from that June meeting to the board, so the board could consider those at the July board meeting, and then kind of go from there. So right now that's the current plan, but I'll keep you all informed, and then we'll have more information hopefully at the July meeting. There was also some other bills. There was one we talked a little bit about for social workers. This bill did not pass, but it was House Bill 2480 that would have provided an exception to mandatory reporting laws if an attorney, a social worker worked for an attorney. But that bill had a hearing. It did not make its way all the way through. So that bill may come up again in future years, but at least for right now, House Bill 2480 did not pass this year. There were a couple of bills that dealt with artificial intelligence, Senate Bill 405 and House Bill 2592. Neither of those bills passed, but they both did. They were assigned to committees. One at least had a hearing. One would limit what AI could do regarding suicide and providing emotional support and acting as a healthcare professional. That was Senate Bill 405. House Bill 2592 would have created a task force on artificial intelligence. Like I said, these were both introduced. They're some of the first bills that I've seen introduced on artificial intelligence, but the one had a specific connection. It appeared towards healthcare and mental health services. So we'll continue to monitor similar bills like that in the future. There was a bill that passed, Senate Bill 30. that would require new occupational licensing changes to go through a statutory process versus a regulatory process. However, that bill exempted the health professions, including the BSRB. So this does not currently limit us in terms of what items have to go through the bill making process. However, we'll monitor that and see how that's going to be applied to different agencies. And then the last item I'll talk about is just briefly House Bill 2582. That is a bill that had some significant changes to the operations of the Board of Nursing. We had talked about that bill, but that was House Bill 2582 that did ultimately pass and has signed into law. It made some changes concerning their operations, specifically sort of some of their timeframes and processes when individuals had a license coming up for expiration, some of their renewal processes. It dealt with some of their past disciplinary orders, and also looked at the board composition and made some significant changes there in terms of replacing their board and making some big changes. So feel free to take a look at that bill if you have questions. And then another legislative update, I'll let you all know, we've talked about this in the past at a few meetings, but every year, a new group of agencies comes up with a responsibility of providing a report to the Joint Committee on Administrative Rules and Regulations, basically going through all of their regulations and talking about, are these regulations required for implementation of state law? If they're not required, are they helpful? Could these be repealed, et cetera, et cetera? And so this is something that we have been in the rotation of. We're coming up this year, so we have to provide a report by July 15th of 2026. I've been working on this report. We will be continuing to work with the staff members on this. If you have any questions about it, please let me know, but we will make sure this gets provided to that committee by that deadline. And then in terms of some other updates, just in regards to some licensing examination changes, Dr. Bernetti Atwell mentioned the upcoming change for the EPPP for the licensed psychology and master's level psychology examination. And that is scheduled to roll out based on those timeframes that she had discussed. Also, ASWB, the Social Work Association that assists regulatory boards that regulate social workers, their new examination is going to be coming out in August of 2026. So we are almost there. More information on that exam and some of the changes are at aswb.org. There are some significant changes going from 4 content areas down to 3 content areas and some other real changes as part of that test, but feel free to take a look at their website. There's also a link to some of that information from our website as well. And then there are some other different meetings and different things that we have attended, but for the sake of time, I'll just let you look through those. If you have any specific questions, please let me know.
Thank you, Dave. Any questions or comments for Dave? Okay, that takes us to updates from 2026 association meetings.
Okay. And my apologies, there was one other association meeting that I neglected to put on this list. It's a state level association versus a national. But Dave Anderson, board chair, and I did attend the annual meeting, a conference for the Kansas Association of Master's Level Psychologists. And there were 2 speakers that we were able to hear from, and so that was a good opportunity to do that. David, do you have any takeaways you wanted to share from the camp conference?
Not a lot. It was actually much more a kind of a CEU event than I was surprised they didn't really talk much about camp itself, but good presenters, both people I know well, and helpful information about presentation on ethics and a presentation too on kind of responding to crises.
Well, we are doing our best to make sure that we have a presence. This one was a virtual, had a hybrid option, but we were able to, I was able to attend virtually, and we previously went to the conference for the KCA, Laura Shaughnessy and I did. And so we're trying to be present at these meetings, make sure we provide updates, or if we have the opportunity, but also making sure that we're keeping these dialogue lines open. So. One of the other association meetings that we attended, I was able to go to a meeting of behavior analyst regulators with board member Linda Heisman Powell. And that was in New Orleans back in March. There were some.
That's a great place there.
There were good conversations too. We had a number of conversations about title protection specifically for behavior analysts. We don't currently have title protection in our statutes for behavior analysts, but we were trying to get a sense of, for the states that have it, what terms are protected. Is it licensed behavior analyst? Is it something more general? Because can individuals call themselves a behavior analyst, or is that protected? And so we got some feedback from a number of different states, and also we're able to put that out on a listserv, and I've collected a few pages of responses from individual states, and so we can share that at the next advisory committee. But we also talked a little bit about workforce. There's a growing number of licensed behavior analysts in Kansas, and that number continues to climb and climb. But we also have a second level of license, the assistant behavior analyst, and that's more of a bachelor's level. And that number has stayed pretty steady. Compared to the growth of the behavior analyst. And so I did ask some of the states, have you had any success in terms of growing that second level of license? And it sounded like most states kind of followed the path that we did. Most of the growth was in their licensed behavior analysts. But it was interesting to kind of compare notes and talk about it from a workforce perspective, because what we have been hearing is the need for individuals to come in at a lower. So
was that Louisiana that had so many assistant behavior analysts? I can't remember which state it was.
yeah, I don't recall. I know there's also a lower level of technicians, and most of the technicians are not regulated by different states specifically. But yeah, I thought it was a really good conference. I learned a lot. They continue to soak up information about that profession. Linda, do you have any takeaways you wanted to share for the board?
I just think that the David, once again, was one of the ones that stood up and discussed the title protection. And he had more than, like, how many responses did you get? Like 15?
I think so, yeah.
Something like that. It was like a significant number of people responded to his inquiry about whether or not they have title protection built into their legislation. And so David really is an advocate and a champion for each one of our disciplines. And so I appreciate that as well. It was fun. We got to the association, blocked off the street, had a band, and we got to march down the street, all of us behavior analysts out there, right? Like with our little masks on, and it was so fun. And then we went out exploring afterwards. So
I mean, it's exciting for me to see so many professionals excited about their profession. And when I see the growth and I sense the energy and things like that,
yeah, it's pretty energetic.
it's neat.
So thank you.
Well, the next one we'll move to is the Association of Social Work Boards, ASWB. They had a mid-year meeting. They call it the education meeting. And that fell the same week as the mid-year meeting for ASPPB. And so my assistant director, Leslie, was able to attend that with board member Cynthia Schindel. And so could you both kind of share some takeaways from the ASWB education meeting?
Well, the first day had separate administrator day and board member day. So that one was just within our separate, and but then the other 2 days we were together for the whole conference. And the focus of this whole conference was supervision. So it was 3 days on supervision and a ton of information. I would really love for someone from each of our professions for us to have at least one meeting or a couple of meetings to talk about the different ways that we're managing supervision. We talked about this a lot with how we regulate or whether we require additional training. There's wild variation across the country in how that's handled, but there are many states that have layers of requirements beyond what I think any of our professions do in Kansas in terms of what's required to be able to supervise. There are some states that apparently prohibit being able to be paid for supervision. And because that's the concern about that being a conflict, there was discussion about the issue of somebody pays you for supervision and they get up to their licensure time and you can't recommend them, and the applicant's expectation that because they paid you that they automatically are guaranteed to be recommended for supervision. So and I had one incident of that in people that I supervised through the years, so that's an example. The keynote speaker was Dr. Ono from Atlanta, and he talked about stereotype threat, which was a phrase I had not heard before. You familiar with it, Rick? So he gave some amazing data, and there's a ton of studies about it. This all loops back to the ASWB's concern about the variation in pass rates that came to light a couple of years ago, and which it turns out, is true across professions, not just mental health professions, in the legal profession, in nursing, et cetera. So the representative from Missouri, the social work representative from Missouri, and I talked briefly about many years ago, we used to have a MOCAN Institute every year, which was a CE event that was jointly hosted by Missouri and Kansas, NASW, which is kind of gutted at this point, but we talked about the possibility of trying to have him and doing a joint conference that would be, of course, available to anyone. So I'm going to be trying to follow up on that with the executive director of MESW of Iowa, who is now currently trying to cover both Iowa and Kansas. So we'll see how getting there on that. But anyway, it was very, very good conference, I thought, as far as the information. How about on the administrator side?
The administrative side, we talked a lot, which is later in staff reports, but we talked about verifications. Many states are they don't fill out forms now. You have to get your verification from the other state's website. Colorado has been that way for a while, and they don't do anything. You have to go on their website. That's it, period. But they talked about that, and then we talked about supervision, a lot about board approved or, the designation of a supervisor. And many states have additional requirements for that. My takeaway, which is good, it made me kind of feel better, is when I first started working here, supervision was not very important. It just seemed, it was just kind of a hoop. It wasn't really looked at like, this is really important. This is training you to move forward and be an independent practitioner. And it seems like that has been replaced and people are serious about it and they really want quality supervision for their licensees. And I appreciated that. So.
Well, thank you both. Appreciated you attending that meeting and thanks for bringing the information back for all of us. The last item on the association meetings was the ASPPB mid-year meeting, and that was in Charlotte, North Carolina. And I attended that with board chair David Anderson and also public member David Stevens. And I thought it was a really good meeting. Some of my takeaways, there was also a meeting with the administrators and some states were seeing an increase in the number of complaints against practitioners. But they were also noting that through some technological changes, there were sort of easier processes to do the complaints. So they weren't sure how much of a factor that was in the overall number of increases. But there was some movement in some states to look at composite board structures like we have here in Kansas. Over the last few years, there have been a few different states that have moved to what I would call a composite structure, to where you have one board, but you have individuals from different professions. There's something similar called an umbrella type structure, which is where you still have separate boards, but they all report things upwards to a committee that has more of a decision-making authority. And so it was interesting to kind of hear some of the states are very much opposed to composites. Some of the states are listening a little. I think, from our perspective, we're kind of an interesting spot because we've had a composite board here for 46 years, but for a lot of states, they've never had one. And so, or it's a relatively new discussion. And so I just kind of, when I get the opportunity, I share things about it. Last year at the ASPPB mid-year meeting, I even did a presentation on some of the benefits of having a composite board. And so just kind of wanted to share those takeaways. There's also some discussion about some recent Supreme Court cases, and I think we'll probably talk about that in more detail maybe at our next board meeting in July. There's some conversations about speech versus conduct and other things. And so feel free to start taking a look at some of those, but there was some discussion at that meeting about that topic. There's also a big focus on artificial intelligence and other changing technologies, practitioner wellness and some of the monitoring programs that some of the states offer. What was a topic? And then we also had a conversation, like we discussed earlier, about the upcoming changes to the licensing examination. And prior to that meeting, we did have meetings at the licensed psychology and master's level psychology advisory committees. And members of both of those committees had expressed concerns about the increase in price for the test going from 600 to 650, and really kind of pushed me to ask for some more information, but also to get clarification on the fee increases that would be starting in 2030 about the informed by the consumer price index. And so at that meeting, I did bring that up in the meeting of the administrators to see if they had similar concerns. I don't think there were as many concerns in that meeting compared to what I might have expected. I think one of the things is the $50 increase from 600 to 650. No one likes an increase, but I think in doing the research, it had been about 13 years since the last increase in price. I think one of the other concerns, though, was, based on the way that the original messaging was, it appeared that there was going to be an automatic increase every 2 years. And I think the lack of stability with that was a concern. So at the meeting, I did go to the podium and ask a question, and I talked with Dr. Bernetti Atwell and said, while this is a meeting where everybody tries to work together, I don't mind asking difficult questions and pushing, because we represent a lot of people back home, and those were the interests that I was kind of bringing to the table. But I appreciated the conversation because no one's afraid to answer the question. And I think I had every board member come up to me afterwards and talk to me one-to-one and just say, we've presented things as a unified board. Here's kind of, my interpretation of this, and we want to be informed by that. But it sounded like perhaps what you shared earlier, that there wouldn't necessarily be an automatic increase, but it would be informed and there would be a conversation. And for transparency, that was helpful to be able to bring back. So wanted to bring that back for you all, but also to let you know that, I really enjoyed the conference, and I thought there was a lot of good information, but also I really appreciate the opportunity to have a voice in matters like that. This is one association where the board members for ASPPB are delegated the authority to make increases to the price of the exam. So as member jurisdictions, our role is to ask questions and make our voice heard. And so appreciated the opportunity to do that. Appreciated the conversations that happened. But Dave, do you have any takeaways from that conference?
Just a couple. As often happens, lots of positive feedback about David Fye and his involvement with members there and staff. A number of people came up and spoke to me about that. I thought there was a number of good presentations on AI, a lot of discussion about AI is not coming, it's here. We've talked a lot in advisory committees about offering people opportunities to opt out, but given the software that's being used, and AI is increasingly a big part of that, and so that's going to be harder and harder. Informed consent is going to be really important, so that they know, is AI part of the billing, is it part of the scheduling, part of the quality assurance, the treatment planning, the documentation, because some groups are building all of that in there, as well as, working to create independent AI agents that will provide, therapeutic services. So really enjoyed those discussions and presentations. Also gave me an appreciation of working on a composite board. Because I think when you go to something like that, you see that slice of how that group sees the bigger picture, right, of the provision of behavioral health services. And so it just reminded me, and I too talked to a number of people about composite boards and really tried to tell them how important I thought it was to have all those perspectives at the table together. So that's it. Good. Okay, that moves us to updates on multi-state compacts.
Well, and I'll probably defer to Richard as Commissioner for the SIPAC compact for the updates on SIPAC.
So as written here, the next meeting, the mid-year meeting for SIPAC will be on Monday, 13 July 2026. And I am just realizing that it's the same date as our next Behavioral Sciences Regulatory Board. So that is something that we may discuss. I don't have any particular updates. We have not received the book, so to speak, for the mid-year meeting. I do serve on two committees. One is the bylaws task force, and we're doing some cleanup when it comes to bylaws and regulations and the language that's located therein. I'm also on the finance committee, and we are gearing up to prepare the budget for next year, for next fiscal year. And as that information becomes more available, I will supply it. We have 134 active psychologists that have a permit to practice via telepsychology, and we have 12 active psychologists that are able to engage in-person services. And that's right around 10, the 134 is right around 10%. And that has been consistent, it seems, over the course of the time that I've been commissioner, where about 10% of psychologists here in Kansas are they hold an APIT. So that is that's my update. There will be a lot more to come after this next meeting.
Thank you, Richard. And yeah, just kind of one of the last items on the agenda is that the next board meeting, the date will be moved to Monday, July 20th. So we want to make sure that you have the opportunity to attend that meeting as SIPAC commissioner. So
I appreciate it.
absolutely. Next, we have the professional counseling multi-state compact, and the commissioner of that compact is Laura Shaughnessy. So Laura, do you have any updates you'd like to share as far as that compact?
Just a few, thank you. New Orleans, Louisiana became the fourth state to join the compact live. So we have 4 states nationally now that are operating and offering privileges. It's great news. Kansas is right there. As soon as we have background check approval and all that's in order, Kansas will be able to go live. We're very excited about that. And our next meeting, the counseling compact meeting, will mid-year take place in Detroit, right after the next the MBCC? No, MBCC meeting in Detroit?
AASCB.
AASCB. All the acronyms, the AASCB meeting in Detroit. It'll be at the tail end of that. So I'll have more to report in late summer.
And just an update from our end on that too. We did get approval for the background checks just recently. So we are in good shape for that. The last item we need is the legislature, we need to have the fee for issuing those privileges approved. And we had submitted that back in January. It's gone through the administrative changes, and it went from the Department of Administration to the Attorney General's office. They made some changes and kicked it back through that process. So we have asked for an update, but once that gets ready and out there and finalized, then we will be able to start having clinical professional counselors go ahead and submit. Did you have an update?
Yes. Charles said that he finished them last week and then got the flu. So we can come, he said he'd bring them when he could. I offered we'd come pick them up. So he said we can come
I'll
pick
go.
them up today. Sorry.
Excellent. Well, we are very close, like Laura said, and what our plan is to do the opt-in for the clinical professional counselors, help them get into that compact. And once we're ready to do that, we'll put out an announcement. Ultimately, the goal is for all new applicants to do the background check as part of that process, but we want to do the professional counselor, clinical professional counselors first to make sure that they can get in that compact as early as possible. We just need that fee approved, so we're getting close. And then the last one on the compacts, the social work multi-state compact, I serve as commissioner for that compact. I'm a member of the rules committee and the finance committee, and we've had several meetings with those different committees recently. We're just trying to project how much operating revenue is going to be needed for that compact to be stood up. They are also finalizing the contract for the data system. And so there's going to be a meeting of the full commission coming up here in June to see if that can be sped up at all, or if any issues need to be resolved with that. However, in terms of the fee, the financing of the commission is likely to be financed primarily from an administrative fee that will take place whenever someone gets a multi-state license. And so we had a discussion with the finance committee, and the way that I look at everything, I think that compact is truly going to open things up with the multi-state license. And I expect there to be a lot of individuals that pursue that. Over 50% of our masters and clinical level license. And I would expect most states will probably see the same thing. So I pushed for the administrative fee to be as low as $10. That met with a lot of pushback. I think we might be able to compromise potentially somewhere around $20. But I put out the first starting thing, in Kansas, we try to keep our fees as low as possible for our agency. And so I thought, based on the volume, that was a reasonable starting point to really push for that. But I think potentially just if it's a little bit higher, that might be more palatable with individuals just concerned about their balance of revenue. So should have more information later this year. Still hopeful that we can go live with that compact either at the very end of the year, or if not, at the very beginning of next year.
Thank you, Dave. Any questions, comments?
May I, with Marianne here, there's a close relationship with ASPPB and SIPAC. I wanted to ask her if there was anything that she would want to add with respect to any updates from SIPAC that I did not mention.
I think you were fabulous.
Well, thank you.
You're welcome. No, I appreciate that opportunity. We really try to keep those two organizations separate. And I think you represented the commission nicely, so I have nothing to add.
Thank
you. You're welcome.
All right, we'll move on to staff reports.
So, the license totals, the report is in the board packet. And, our licensing continues to grow, so that's a positive thing. I won't go into any specific numbers, but if you have any questions, the report's in there. As I said in the, at the meeting, about verifications, many states are not filling out the verification form for other states. Kansas has a pretty lengthy verification form for reciprocity, but that's because it's written into our law that if the other state provides us the degree information and the exam information, we don't have to get it from the applicant. They don't have to send a transcript. They don't have to send a score report. But many states won't do that anymore. So the administrators wanted a pinky promise that we would all move toward not filling out forms. And I will say the states that do cost a pretty penny. Kansas used to charge $5. And at some point, the governor said that they didn't want us charging for certain things, and we took away the fee, and we've never put it back. And it's a lot. It takes a lot of staff time to do that. And we don't charge now. So we do have primary source verification on our website. So they would get the same information from our website that they would get from us if we fill out the forms. But they ask that we bring that back to our boards and see what their thoughts were. So if you guys want to think about that, maybe we can put it on a further agenda.
To make it where we would no longer provide.
Yes, we would
written.
just say that they can get it on the website.
How many do you execute in a month? Do you have a sense of that?
I don't, but I know that, I can look and see what's in our file. There's several a day.
Several
Yeah.
a day?
Yeah.
Wow. Okay.
Yeah, everybody's
Right?
moving.
Mechanized. that.
Yeah, and other states they charge 25, 65. And
Does that go back to the applicant? The cost?
yes. And, the way that our financial stuff is, we can charge the cost of what it takes us to do that. And then it goes to the, how do you really judge that? It depends on the form. One form asks for 3 things, one asks for 3 pages. So, you know. So, yeah, it takes up, and I can get numbers for the next meeting, but, we do have quite a bit. I know Emma did that and now Misty's gonna be doing that since Emma left. So I'll ask Misty to let me know. And then, finally, my last, query of the board. While we've been doing all the regulations, and there have been many, many regulations, one of them is the application regulation for all the professions. And when we've talked in different committees about the regulations, the one thing that stuck out to me is, so LPCs, LMFTs, and LMLPs, they said, their regulation says, for someone applying for the clinical level, if you have not provided these forms, then you have to provide like your practicum professional reference and the other 2 references, which the other 2 are not the issue. It seems to me that after 2 years of supervision, the practicum reference really isn't going to do us any good. And it's difficult for applicants coming who have been out of school for however long they've been out of school. So my question to the board was, could we perhaps change that to their most recent work supervisor along and have only the work supervisor and then the attestations?
Certainly would be more relevant to how licensable they are.
Right, yeah, because we do get information on occasion, because social work has been doing references. And they were the only profession that had to do that. And so we're changing theirs, but in the process, I have seen things come up from the work supervisor. So I thought maybe that if the board wanted to consider it or take it back to committees, I don't, however you all would like to
So
review that.
social work has an employment reference at this point, and then your clinical supervision forms.
Right.
And they have 2 other, they have to have 3 references.
3 references.
Even if they're an LMSW. So we're changing that one.
It's to be just one
Mhm.
employment place.
Yeah, they're
Your
just
base
their
and
work
then the
supervisor, yeah.
Because they have to be LMSW to do their LSCSW training anyway.
Do you remember the history on like MFT and?
I don't, when they did
PCs?
the clinical levels, they just said, if
Yeah.
they're already an LMFT, they don't have to do the references. But it's people who are coming that aren't LMFTs that we're getting the practicum, and it's really not relevant anymore. So I think they
Depending on
just,
who they are, sometimes those people may not be around.
right.
Oh, yeah.
Oh, that happens a lot.
A lot, yeah.
Yeah, then we have to get a letter from the school, and some schools have the information still, some schools don't, it's a hassle for the applicant and for staff. I mean, it's not huge, but it's, everyone questioned, well, what do I do? I can't find my supervisor, and then some schools just don't respond to the applicant, and that stresses them out, and, it's just a hassle, I think.
I wonder if when you guys go to visit the schools and you're talking to the students about getting licensed and whatever. My instinct was to save every piece of paper that
Right.
documented what I had done
Right.
forever, but maybe they need to be told that.
Right.
Because even if we change it in Kansas, another state might not, and they
Right.
might need to be able to pull that back up.
Well, I can also say, as far as references go, not a lot of states require professional references.
Really?
Yeah, Missouri has something on their form, but the person just signs the application form and that's their reference. They don't have forms, and a lot of states don't have references.
If MFTs, for example, were to make this change, would there be consistency across professions if we both did the LPCs and MFTs? Would it be, or we still have variances among professions at the independent?
If your 3 three masters level, LMLP, LPC, and LMFT would changed it to just require the work reference, then it would be consistent with what social work has done.
Is there a need to take that to advisory committees, or do you all feel comfortable in?
I feel comfortable with
I
it.
feel
It
comfortable
makes a
too.
lot of sense.
So do I.
Okay. Thank you very much.
Do we need a motion or
Yeah.
anything?
So do we need to officially, since it's a regulatory, is a regulation change or?
Yeah.
Yes, it's a regulation.
I think that's what would be good, be helpful. If you're in support of what Leslie had described, I don't know if it needs to be specifically articulated, we could clean it up, but, could you maybe just paraphrase, Leslie?
Oh, that the references for clinical levels of the, master's level psychology, professional counselor, and marriage and family therapy, that they are required to have one reference from their most recent work supervisor, along with their clinical attestations for clinical license application.
So moved.
Second.
Okay, we have a motion and a second. Any further discussion? Hearing none, all in favor of the motion, please say aye.
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 Opposed, same sign. Motion carries. Thank you.
Leslie, thanks for bringing this up. Thanks for leading the way in social work for streamlining the process.
Yeah.
I was gonna ask you, are you talking about that like LMAC level or?
Yeah,
LC?
I just realized that I didn't include addiction counselors. I'm sorry.
I'll amend the motion,
Yes, to include the
but if
addiction
Jill's
counselors,
comfortable.
Are you good with it, Jill?
Yeah, absolutely.
include masters addiction counselors going to clinical level.
You just need a second for the amendment?
Yes.
Second.
Okay, so we have an amended motion. Any further discussion?
Anybody else want on there?
Yeah,
Anybody?
all right. All in favor of the amended motion, please say aye.
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 Thank you.
Opposed, same sign. Amended motion carries. Thank you. Anything else?
Nope.
All right, thank you. That takes us to the Complaint Review Committee report.
Is there feedback? Okay. In your information, there are statistics that we gather each month regarding the complaints that the board receives, and then also statistics regarding decisions made by the Complaint Review Committee. At the end of fiscal year April 2026, we received 211 cases. This puts us on track with last fiscal year, in which we received 252 cases, which is an ever increasing amount of cases that we investigate each year. You might also want to note that last month we received 29 cases, which is a large amount of cases.
Barry, anything you wanna?
Yeah, so I'm looking at, trying to interpret this a little bit, to make sure of the cases closed, where the cumulative number for cases closed, is it, do we? I think the month by month is good, but I'm trying to figure out on the versus the total open cases.
Okay, so that's all the cases that we have open. So they could be open for various reasons.
Okay, so
So
currently.
you see total number of open cases, is that what you're looking at?
Yes, and but the closed number are the closed that were closed in the month of April or cumulatively?
You're looking at number 46? That was the ones that were just closed in the month of April.
So do we have where the, of the 352, how many are open?
352 cases are currently open.
Okay, and okay, got it. I'm following now.
And so just We closed 29, we received 29, we closed 46, and 352 are open.
Is it possible to get an analysis of what these cases are about? What's the primary purpose for the complaint? To see if there are trends that maybe we may be able to address. Is or has that been done?
Yeah, that's great. And I was looking at the website earlier and I was looking at one of their disciplinary summary reports. And they have they have that broken out by types of complaints. And that might be good information for the board.
Yeah, we're looking at some of our process changes in this area. One thing I was intentional about for the ASPPD mid-year meeting is I basically said, you know, we'd like to make improvements in all areas, and one of them is to really dig into the mechanics of, you know, what we're doing and how we're doing it. And I asked a lot of my peers if they could provide some different information in terms of their processes and how they're doing things. And I've been able to collect information from Arizona, Nevada, and Texas. And Saskatchewan said they would also send some information too. Because yeah, we do want to provide good information to help you understand more information about these disciplinary cases, while also knowing that some information has to remain confidential as it's linked up to different individuals. But and some of it is a little challenging too, in the sense that there's not always just one issue involved in a complaint. So we can't say there's 10 that deal with confidentiality, there's 10 that deal with dual relationships, when sometimes there's a crossover. But we can definitely provide more information. And it sounds like you all would like some additional
Yes,
information.
yeah. Categories of complaints to
Okay.
have some, like you said, be able to track the trends.
Yeah, we can definitely provide more of that. And we're working on, like I mentioned, the other states and province, what they are doing with their disciplinary processes. So hope to have some recommendations to you all in some upcoming meetings, but we can adjust our reports and provide more context too. So.
And is it helpful to look at those states' processes about how they get that data? So we might be able to not have to reinvent the wheel. Does that make sense?
Part of the problem is that we're a multidisciplinary board. So like a lot of states can say, you did this, that correlates to the regulation and the number, but we have 7 different numbers.
Gotcha.
So they are, yeah, that's part of the issue.
Yeah, sometimes people have multiple licenses, and so to avoid double counting, sometimes we try to identify either the license that they were using when the conduct occurred, or at least, you know, their primary license if they were employed specifically with that license. But yeah, there's also an issue with double counting if you have maybe 7 violations for one person and you only have 1 for another. And so we don't want to double count, but also we want to give you good information too that helps you understand the picture. Maybe one that would say how many of these are individual single violations where we can pinpoint to one area, and how many of these are the complex ones that would involve multiple different issues.
It still would be beneficial, though, that even when to have that dichotomy, how many were single issue, how many were multi-issue, and then looking at the different areas within the multi-issue to see if there's a trend there, right? Like when they have multiple issues, it tends to be in these areas. And it could be, you know, when you think of some of the professions that, especially in Kansas, because we're rural, there's probably a lot of dual relationships that occur. So that could be something.
And we may be able to also separate out the dual relationships that are of a sexual nature versus the non-sexual dual relationships. I've seen a split in that categorization. Dr. Burnett Yamal, I saw that you had hand raised.
Yes, I think this is really a very interesting conversation, because we know each jurisdiction adjudicates a little different. So I was just at a meeting last week whereas one jurisdiction was speaking that their board is pretty independent in how they adjudicate a case. I mean, it doesn't go to an administrative hearing court. It was very different. I mean, it had all this autonomy and I was like, how does that even happen? Because I know when I was in Missouri, it took a lot to get through the AHC and to adjudicate whether it was a probation, whether it was a revocation, a suspension. So I think that's, I mean, you know, I sit here and I'm seeing these different professions all around this table and there's such a benefit from what you all bring together for the behavioral health field. So I'm taking some of this back even in my mind on how we receive information and how we put forth our report. And even the signature, we have our credential thing. So, we only serve psychology. Immediately want to find a solution in regards to where you put those signed documents. And so it's like, there was one repository that could take care of all these behavioral health communities just to have that credentials thing. And so don't tell my board, but I'm trying to find solutions for some of that.
Tricks.
Thank you.
Any further comments or discussion? All right, we'll move on to professions report. Start with the.
Can I, one comment is that, knowing, what the categories are and what the trends are, would have a strong implications for the whole supervision piece.
Yep.
And education.
Right.
And how we
Yeah.
want to train our practitioners. So I think it's really important for us to.
Well, it
Have a-
could, the other thing that we've talked about is, having. Like when we place sanctions on someone and request that they do continuing ed, it would also give us a standard process across disciplines on what we want to recommend as well. Like in terms of continuing ed and supervision. Right?
Have
I agree with
some pretty consistent themes, and we usually tie continuing education and supervision directly to
To
the
the
violation
offense.
or finding. So, but I would say there's essentially categories that we're working
Right.
within all the time.
But I'm talking about before they have.
Oh, absolutely.
So that we can provide
Yes.
training and supervision that will maybe prevent some of those offenses.
And then Dave and Leslie, when you're out talking to students.
Yes,
You can also, these are the more common
Yes,
violations that come up, especially, let us talk about these, what do they mean, let's really prepared not to do it.
yes, definitely.
All right, licensed psychology.
I will be very quick because I realize how much time that we have. Licensed psychology met on Tuesday, the 14th of April, 2026. And we discussed a number of things. One, we reviewed some of the legislative changes.
We're getting some feedback from Cindy, so I went ahead and muted your.
All right, we talked about some of the bills that have gone through and that have been signed into law. We had a really good discussion about AI and we made recommendations with respect to regulations for the use of AI in clinical work. We also discussed some matters related to ASPPB. So there was the Model Disciplinary Act. We had a discussion about that. And we also had a discussion about the changes with respect to mutual MP. We will have continued discussion regarding the postdoc year requirements. And that is Leslie's nodding her head. That is that is something that has been ongoing for some time. And we discussed initiatives out of Texas with respect to an alternative to the ECCC that elicited a fair bit of discussion. And our next meeting will be Tuesday, I believe the 9th of July, excuse me, the 9th of June, 2026 at 6 p.m.
Thank you. Social work.
Yes, the Social Work Advisory Committee met on Tuesday, April 7th. And we talked about all of our usual updates on the compact, et cetera. We talked also about our vacancies that are coming up on the and several that are going to re-edit their being on the advisory committee. We have ongoing discussion about artificial intelligence. I just heard on the radio this morning that there's a state that's considering making AI a person for the purpose of suing them it was a situation where someone consulted ChatGPT about the weapon he was gonna use for a mass shooting and how many people could he kill with that. And because the ChatGPT gave the answer, they're now talking about trying to make AI a person give it person status legally. So yeah, it's definitely not coming. It's way here.
What
Right,
state, do you remember what state that was, Cynthia?
I wanna say Virginia, but don't quote me on
Okay,
that.
I'll look it up,
Yeah.
not on ChatGPT.
Yeah.
Yeah.
It was on NPR this morning.
It's an interesting distinction because they were talking about, a program that you consult versus a program that is trained and can make
Yeah.
decisions for it on its own. And that was what they were confronting in this lawsuit is if they can make a decision, make a choice, then do you sue the person that created it, that trained it? Because they weren't able to train it somehow to not make that choice. I don't know. Anyway, yeah, a big topic, which we will be continuing to discuss. We also touched on alternative pathways to licensure, which has been an ongoing discussion ever since the alternative to passing the exam because of the variation in pass rates. No conclusions, but we're continuing to discuss those topics. Our next meeting is on June 3rd.
Thank you. Professional counseling.
Professional counseling did not meet this month. We had an illness that got in the way. And so we are going to meet again on June 1st at 10 a.m.
Thank you. Master's level psychology, we met on April 1st. We've got 2 members coming off the advisory committee. So invitations will go out or have just recently gone out. We spent a significant amount of time, and I would recommend that you all think about doing this, going over the BSRB's investigative and disciplinary process within our committee, really to help committee members better understand that process. And we talked about the most common complaints for our specific group. And hopefully, as kind of has been discussed here, that group will then take that information back to their places of work and have discussions and talk about what that means in terms of ongoing education and supervision. We had brief discussions about the revised EPPP timeline and increase in cost, as well as the possibility at that point of a licensing exam for master's level psychology. Our next meeting is June 3rd. Marriage and family therapy.
We have not met since the last board meeting and we are in process of rescheduling the June meeting date, so I don't have any other updates.
Okay. Addiction counseling.
The Addiction Counselor Advisory Committee also has not met since just prior to the last board meeting. We will meet on June 15th, 2026. And as David noted, he is working with a representative from Acadia Healthcare regarding their requested legislation to create an apprentice addiction counselor category of license. And that should be hopefully quite informative to members of the advisory committee.
Thank you. Behavior analysis.
Yeah, we met on Friday, April 10th. We talked about changing, looking at our supervision requirements and changing it to a percentage of hours worked so that it more closely aligns with the DACB standards as well. Also the documentation, because there are specific requirements for behavior analysts that only percent of your supervision can be group supervision. And no percent has to be individual, and it has to be live. And what live means, that it can be either in person, face to face, or via telehealth. We talked about alternative pathways to licensing. The behavior analysts are a little bit resistant to alternative pathways to licensure. So that will be something that we will continue to discuss at future meetings. We looked at our members. We had 2 members that were up for reappointment. One of them agreed to stay on the board. The other one was a little bit non-responsive. So David sent out a call for a new member. We had a couple of other things that we were looking at. One of them is, of course, the title protection, that Dave was so good about sending out a survey to the other states for their responses and whether or not it's included in their legislation. And then we're gonna continue to talk about topics for discussion in 2026, which there will probably be a lot of them, given the current news that's coming out about Medicaid and Medicaid fraud and whatnot across the country with regards to the practice of behavior analysis and autism treatment. And our next meeting is scheduled for June 12th at 1.
Very good. Thank you. We're now scheduled for a 10-minute break, so let's plan to be back at 11:50.
I love eating on YouTube.
Just adds to how much we all like seeing ourselves.
I'm noticing the back of my hair is not like.
Angles that we don't really wanna see.
Okay, Jim and Jill, can you hear us okay? Okay,
I'm
All
back.
right. Welcome back, everyone, and be patient with us as we try to eat and move along. We're now at old business on the agenda, and we're going to table the continued review and discussion on changes to unprofessional conduct regulations, just for the sake of time. But again, that's extremely important work, and we appreciate all the time and energy you've put into that thus far. In terms of the strategic plan, Dave and I visited, you've got some information to start kind of the process of thinking about doing a SWOT on the functions of the BSRB. And I think what we're going to do is move that to our retreat and spend
Oh,
a
that's a good
significant
idea.
amount of time at our retreat doing that. So please take a look at the information that's been sent out and start thinking about that in terms of, we'll have our retreat in September, is that right?
September 28th, it'll be a Monday.
Okay. That takes us to new business. A couple of things that at our next meeting in July, we will be taking nominations for chair and vice chair. If you have interest in either of those positions or questions, please feel free to reach out to Mary, myself, Dave, Laura, if you have any questions or interest. And then when we meet in July, we'll take and vote on nominations at that time. Again, in the interest of time, as chair, I will reappoint all individuals that are listed in the agenda for the advisory committees to the next term for each of those, so we don't have to go through that name by name.
And so each of these individuals is currently already serving on an advisory committee, and they are eligible for reappointment, and they have requested reappointment, and so they will begin this new term starting July 1st. So we will notify them after the meeting.
And then we want to recognize advisory committee members who've served the maximum length of time they can on their advisory committee. Dulcinea Rexstraw on the addiction counseling, Mike Gillett, Leanne Gentry, and Robin Unruh on the social work advisory committee. Again, people take time out of their very busy schedules to work on the advisory committee, and we greatly appreciate their time and effort. The board as a whole relies on feedback from the advisory committees and the people who are willing to spend time, and that's what, 8 years? So thank you to those individuals. That takes us to D, review of recommendations from advisory committees.
So this is an item that had been referred to each of the advisory committees for discussion, and that was the concept of what is the board's role as far as regulating artificial intelligence, or alternatively, where should the board provide guidance in terms of practitioner responsibilities if they are using artificial intelligence? And so a lot of the advisory committees basically decided to focus on this lens under unprofessional conduct. And so the social work advisory committee did have a discussion about recommendations, and they are similar to what some of the other committees have put forward as recommendations too. The first involves confidentiality and responsible use of technology. So if you are using artificial intelligence in terms of client care, you make sure that you are using technology appropriately to keep essentially confidential information confidential, to paraphrase it. And then secondly, have informed consent, so that if you are using AI in terms of client services, that you keep individuals informed. And then the opt-out piece that we had talked about before in terms of allowing individuals, if they do not want AI used as part of their client services, that they have the ability to opt out. So there's no action that you need to take right now, but we have provided 3 recommendations from different groups in the past, and social work had provided recommendations their last meeting. We will continue to bring these forward to the full board for your review, and then ultimately ask how you would like to consider these on a board level, if you'd like to make these consistent across all the professions or pursue something else.
If I may, just a note to follow up on something David Anderson said earlier. The idea of opting out is very complicated at this point and may result in limited access to service, because the opt-out may mean you aren't able to have service therapists because of how people are moving forward. So just something we should think about when we think about these.
Some of the, to piggyback on that, some of the software doesn't allow you to turn off certain features.
Agencies would have to have a
Yeah,
separate track for record keeping and whatever, which that's, I don't see that happening.
Okay, thank you. Any further discussion? Then we'll move to discussions on alternate pathways to licensure.
This is another topic that the board had referred to the advisory committees. Several advisory committees have discussed this and decided they didn't want to put forward any recommended changes. There's at least a couple that are still having an ongoing conversation on this topic. And so I don't believe there's any recommendations ready for the board yet, but we're just going to keep this on the board's agenda. And then if those committees decide to refer recommendations to the board, we'll bring those to your attention for you.
That would require statutory change, though.
It depends on probably the recommendation, but a lot of the steps for licensure are specific in the statute.
Right.
So if it were to change any of those, it would require a bill.
Okay, thank you, Dave. All right, we're next going to move into an executive session in regard to attorney-client privilege communication.
So I have language for a motion that has been pre-drafted. I will read this language and then I will ask if a member of the board would like to make this motion. And then you can just let me know if you would. The motion does say essentially why we're going into executive session. It has to be one of the reasons outlined in the relevant statute, which it is for this purpose. And it does say how long executive session will last. And it does say when we will return. I believe for this executive session, Tim, does 20 minutes sound appropriate?
I think so. It depends on questions, but
Okay.
I think that's reasonable.
Okay. It is now about 12 o'clock. So probably by the time that we read this motion, if we were to add 20 minutes, let's say by the time this motion could take place, it would be about 12:03. So we would say the board will come back at 12:23. Let me go ahead and read this motion, and anyone who's not listed here will have to leave the room during the executive session, but then we will rejoin the meeting afterwards, and then individuals can come back in. So this is the language for the executive session motion. Pursuant to KSA 75-4319, does a board member move that the board recess into executive session for 20 minutes and reconvene the open meeting at 12:23 p.m. The meeting will be reconvened remotely by conference call at 1-877-278-8686, PIN number 327072. By Zoom as directed in the notice of meeting that was sent to individuals who had requested notice and is published on the board's website, asbsrb.ks.gov. The justification for closure is communication with the counsel that would be attorney-client privilege. David Fye, Executive Director for the BSRB, is to be included in the executive session. The subject to be discussed in executive session is for consultation with an attorney that would be deemed privileged in an attorney-client relationship. So would the board member like to make that motion?
Second.
Very good. We have a motion and a second. Is there any further discussion? Hearing none, all in favor of the motion, please say aye.
Aye.
Opposed, same sign. Motion carries.
Okay, so the board meeting will continue, but we will have listed on the YouTube channel, meeting will reconvene at 12:23. And we will switch out board members. You should have received an email that had a separate Zoom. So we will go ahead and have you log out of this meeting, and then we will have you log into that meeting. So we'll go ahead and start that process. We'll be back at 12:23.
So we all.
Do you want me to?
Okay, we will let everybody back into the. Not yet. Okay.
Thanks for that.
And Andrea and Jill, can you hear us okay?
Yes.
I hear you.
We should be back from executive session. We have, Dave, give me just go to the next item.
Sure.
Okay, we are back from executive session. The next item on the agenda is an executive session concerning personnel matters. And so with the previous executive session, I have a pre-drafted motion. So I will go ahead and read that motion. And then I will ask if a member of the board would like to make that motion. So the language of this motion, I guess, for this motion, it will probably also go with about 20 minutes. That'll make sure that we have enough time. So basically, this motion should end roughly at probably about 12:50. Give us some time to come back. Okay. So the language of this motion says pursuant to KSA 75 74 4319, 75 4319. I move that the board recess into executive session for 20 minutes and reconvene the open meeting at 12:50 p.m. The meeting will be reconvened remotely by conference call at 1-877-278-8686 and 327-072, and by Zoom as directed in the notice of meetings that was sent to individuals who requested notice and is published on the board's website, ksbsrb.ks.gov. Notification for closure is personnel matters of non-elected personnel. David Fye, Executive Director for the BSRB, is to be included in the executive session with board members. Again, the subject to be discussed in the executive session is personnel matters of non-elected personnel. Would a member of the board like to make this motion?
Oh,
That's okay, I'll do second.
Okay, so I think Cynthia was the person who moved and then Mary seconded.
Very good. So we have a motion and a second. Any further discussion? All in favor of the motion? Go ahead.
After the motion, I just need to make, after the vote, I need to make a comment. Is that okay?
After the vote, he said he had a comment.
Okay.
Mm.
You don't
Would
want
that
to
be
make
discussion now?
I will not be able to attend the next executive session.
Oh, okay.
Thank you, Jim. I saw your email. Appreciate the heads up.
Okay,
Great.
thank you.
All in favor of the motion, please say aye.
Aye.
All right.
Opposed, same sign. Motion carries. Thank you. We'll now go into executive session.
Okay. So Leslie and Tim, I'll need you both to leave and it'll just be the board and myself.
Do you want me to take one of the computers again?
Yes. Thank you.
Under my Zoom AI, it says postpone follow-up.
Oh, okay. Well, that's fun.
Yeah,
There you go, there's your AI.
right? Now I know what you guys were talking about.
Okay, we'll restart the audio recording and unmute the conference call. And we should be back. Jill, can you hear us okay?
Yep.
Very good. Thank you. All right, well, welcome back all. Before we break up today, again, Dr. Benetti Atwell, thank you so much for joining us and making the trip out to Kansas to see us. We have a board meeting scheduled next for July 20th, so that's not our normal meeting date, but to make sure that Richard could be here, we're moving it back a week.
Thank you all again.
Make sure you update your calendar and don't do what I did last time, which is wonder why I wasn't getting notice the day before.
It was showing up.
Anyone have anything else before we move to adjourn?
Just a note, I think, well, two notes. The September board meeting, I think, may also fall in a tricky time period because I think Mary and I would be at a conference for CLEAR. So we may need to move the regular September board meeting to a different date. So we'll try to gauge when that will work out best for all of you. And then also in terms of the out-of-town board meeting, that is scheduled for Monday, September 28th. Andrea is one of our board members from the Kansas City area in Kansas City, Kansas. So I've been talking to her a little bit, and we've been starting the process of looking at potential venues to host us for the hotel and then also for the conference or the full day meeting. So I should have more information for you at least by the next board meeting in July. If we get information locked in before that, we will let you know. So.
Very good. Thank you, Dave. All right, if there's nothing else, again, thank you all for being here, and particularly those of you who came in today. It's great to see you all in person. I would accept a motion to adjourn.
So moved.
I second.
Okay, we have a motion and a second. All in favor, please say aye.
Hi.
Thank you all. Have a great rest of your week.
Thanks, everyone.
Thank you.
Thank you.
Oh, look at that. Dale.
On to that.
Non-con.
Oh, 5 minutes early.
We have so